Greetings and thank you for joining us for this installment of our APHI Innovations in Public Health series. I'm your host, Michael Thompson. I'm an associate professor of public health sciences here at UNC Charlotte and associate director for APHI, the Academy for Population Health Innovation. APHI is the collaboration between Mecklenburg County Public Health and UNC Charlotte, where we seek to bring practitioners, scholars together to share best practices, discuss cutting-edge innovations, and find common ground as we pursue our shared mission of improving and assuring the public's health. My co-host today is Carrie Birch. Carrie?
Yes, good morning, everybody. I'm Carrie Birch with the Office of Innovation and Strategy at Mecklenburg County Public Health. Excited to see so many folks joining us today. Had to keep paging over to see all the folks that were joining us. So about the program, we envision these virtual sessions as providing opportunities to engage and interact outside of our daily silos. To encourage dialogue, we've enabled the participant list and private message function. So we encourage you to look through the list and keep scrolling till you get to the end and reach out to someone maybe you haven't connected with in a while, or if you're feeling particularly extroverted today, feel free to introduce yourself to someone new, make some new connections. Later in the program, you'll have a chance to give feedback via a Qualtrics survey link that we'll post in the group chat. Michael?
Yeah, so as you noticed coming in, we are recording these sessions, so we'll be posting at our APHI website, aphinnovation.org, so that you and those unable to join us can revisit as often as you like. And while we're there, you can check out our prior seminar library and all the other ways APHI is supporting public health in Mecklenburg. Today, as you'll hear, we're focusing on how community health workers are helping reduce health disparities by improving maternal and child health outcomes. We're pleased that this session is worth one contact hour for ACHE or CPH, a self-report, CHES, there's a follow-on survey, as well as social work contact hours. To receive these things, you will need to complete the evaluation that we put into the link at the chat during this session, and make sure you complete that survey. There's an extended part for those requesting CEUs. Carrie?
All right, so our panelists today are Keila Marlin and Omeika Dhanpaul. Keila is the Health Program Manager over the Community Health Worker Initiative with Mecklenburg County Public Health, and Omeika is the Program Supervisor for A Guided Journey with Caring. Both, of course, share a passion for improving community health and working to address health disparities. I believe Keila is going to get us started, so take it away, Keila.
Sure, I will share my screen. Okay. So good morning, everyone. As Carrie mentioned, my name is Keila Marlin. I am the Community Health Worker Initiative Program Manager at Mecklenburg County Health Department. And alongside me is Omeika Dhanpaul, who is a Guided Journey Supervisor at Caring. And today we will be presenting on how community health workers address health disparities in Mecklenburg County. So I would like to highlight and elevate both of these organizations, as Mecklenburg County is in formal partnership with Caring, who is a Guided Journey's proud service provider. And so a really quick disclaimer, the viewpoints and comments expressed in this presentation are of the authors and do not represent the county or Caring. So we'll begin with a few definitions, and this one I feel that we are mostly familiar with. So health disparities refers to differences in health and healthcare between groups of people who have systematically experienced greater obstacles to health based on their racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, geographic location, or other characteristics historically linked to discrimination or exclusion. And so this is a really long definition that basically says that there are differences between groups and that has been historically linked to discrimination or exclusion. And so a sub-definition to this is healthcare disparities, which typically refers to differences between groups in healthcare insurance, access to and use of care, and then quality of care. And we'll see later in the presentation how community health workers factor into this equation. And so the next definition, or term rather, is a community health worker. And so this definition derives from the American Public Health Association, who defines a community health worker as a frontline public health worker, as a trusted member of and has a close understanding, an unusually close understanding of the community that enables them to serve as the link between health and social services to facilitate better access to care by improving the quality and cultural competence of service delivery. So the Community Health Worker Initiative has adapted this definition to incorporate the word intimate in lieu of unusually close, just because whenever the community health worker builds and that connection with the community and or individual, that is no longer unusual, it's intimate and highly relational. And so the community health worker becomes that community's wealth of knowledge in terms of providing health education and literacy, someone that the community can confide in and to whom they know will advocate on their behalf. So the term community health worker is an umbrella term that encompasses a bunch of other names that do similar, if not identical, work of a community health worker. So on this slide, you'll see names like community health representative, which is indicative to the indigenous population, so the Native Americans of America, or promotor de salud, which is indicative to the Hispanic or Latino population, and then a slew of other names that are really specific to the organization or the service provided by the community health worker. So when we begin to think about a community health worker's scope of work, it can be very broad or specific to the organization or community health worker's skill set. So here are 10 essential roles elevated by the C3 Project, which is a national group that convenes CHW organizations and regional coalitions to better understand and align what community health workers do in community and clinical settings. And in these roles are a range of responsibilities of which a community health worker can conduct. So I'll note that this list is subject to change and under constant reassessment by the C3 team as they continue to work with these organizations and coalitions on how this work continues to evolve. But I do want to provide a quick example of one, and I'm specifically going to drill down on service coordination and navigation, because that is a part of a guided journeys work, which is 1, to participate in care coordination and case management, 2, make referrals and provide follow-up, 3, facilitate transportation to services and help address barriers to services, 4, document and track individual and population level data, and then 5, inform people and systems about community assets and challenges. And so just within that one role are 5 responsibilities, and can be a full-time job depending on the caseload and the needs of the community. So as I alluded to earlier, community health workers' scope varies by setting. So what a community health worker does in a clinical setting will look very different to what a community health worker does in a community setting, whether they are based in a church, a homeless shelter, a refugee camp. And so all of this is to say that this work looks different in every setting and is truly justified by the needs of the community. So to add additional context, the pandemic has drawn new attention to and compounded existing disparities in health and healthcare, where minoritized and socioeconomically disadvantaged groups were already experiencing high rates of illness, hospitalization, and death. And these groups of people, as I mentioned earlier, are linked to those social, economic, and environmental inequities that prohibits the individual from achieving their highest level of health. So on this slide, you'll see that Kaiser Family Foundation does a really good job demonstrating how social and economic inequities impact everyday life. I want to highlight the gray band of racism and discrimination that spans across all categories because there are larger policies at play that intersect how these two factors would inhibit an individual from achieving their highest level of health. So for an example, a previously incarcerated Black male who has a family of 4 would experience certain barriers in terms of receiving secure housing, obtaining a job with a living wage, while dealing with all those components highlighted in the community safety and social context box, opposed to his white counterpart that hasn't experienced any of those barriers. Or perhaps another example would be an immigrant family that has recently migrated to the US who would deal with barriers in all 6 of these categories as opposed to an American who already resides in the country. So there is a bunch of literature that already exists and speaks to the disparities that each race and or ethnic group may face. But again, Kaiser Family Foundation highlights these disparities in a graph where minority groups reflected fair, worse health statuses as it pertains to infant mortality, pregnancy-related deaths, prevalence of conditions, and overall physical and mental health status. And this was pre-COVID. So imagine what these rates are now among these race and ethnic groups now that we're dealing with COVID and monkeypox and other emerging diseases. So when we specifically look at maternal-child health, recent data has shown that maternal deaths in the first months of the pandemic increased by 33% and was even higher among Black and Hispanic women. And while COVID was listed as the secondary cause of death, other direct causes point to diabetes in pregnancy, high blood pressure, and other pregnancy-related factors that are linked to race and ethnicity, age, and socioeconomic contributors. And so again, community health workers are naturally primed for serving the community, and this has been reflected all across the US with their efforts during the height of the pandemic in terms of testing, screening, and in some cases treating. They have served on clinical and community teams as the bridge to health and social services, and their role continues to highlight the many ways they can serve as it relates to addressing high priority public health issues and healthcare needs in our community. So as such, the health department has leaned into how health systems can integrate social care into clinical and community settings by implementing a guided journey. So this program was launched as part of Mecklenburg County's priority funding to address health disparities among mothers and families in designated public health priority areas by utilizing the community health worker model as a means to link women to prenatal and postpartum care and other supportive services in Mecklenburg County. So Here's a list of community health worker models, and I won't go into every single one, but I should also note that this is not an exhaustive list, as it can be adapted to the organization or to the community needs. However, outreach and enrollment agent model is highlighted as a guided journey, utilizes components of this approach. So community health workers help individuals to enroll in programs that provide healthcare and social services via NC Care 360. They also serve in an outreach capacity where community health workers conduct home visits by assessing and assisting people who are eligible for programs but experience barriers to enrolling. So with that, I'll conclude here and hand it over to my co-presenter, Omeika.
Good morning, everyone. And I will share, Keila did a good job in giving you all the background of our community health worker and the work that they can be engaged in. And so I just want to share with you our program and what we do with a guided journey here at Caring. And in our program, we do believe that a healthy pregnancy is one of the best ways to promote healthy families. And so in Mecklenburg, we are doing that with utilizing our community health workers. And as Keila mentioned as well, we also do believe that early and regular prenatal and postnatal care is an important part in a woman's pregnancy and after she gives birth. Next. And so within a guided journey, we have our program structure, and I'm just going to share with you a little bit of how our program is structured. And so our program is made up of we have our program director, which is Miss Sharisa Falls. And so she oversees the general functioning of our program. And then myself, I am the program supervisor. And so I oversee the day-to-day activities of the program and our community health workers. And our community health workers, they are the ones who work directly with our participants or clients within our program. And our program at Caring, we complement nurse-family partnership, and I would just share a little bit more about that in another slide. And also within our program, we have bilingual staff. So we do work with both our African Americans and our Latinx population. And so we have staff who are able to work with those participants, speak their language, and also are from those backgrounds themselves. So they'll be able to be more culturally competent and culturally sensitive in that regards. And our priority health zip codes. So we do focus on priority zip codes in Mecklenburg County, and I'll share with you a little bit later on about why we focus on these zip codes. However, because we focus on these zip codes, but we do not necessarily only would accept participants that are in these zip codes. We also accept participants in our program who lives within Mecklenburg County. And as mentioned before, our goal is really to bridge that gap, ensure our moms, our participants are connected to prenatal care. Some of our participants might come into our program and they might be uninsured. They might not have OBGYN that they'll go to. So our community health worker works with them in that regards to ensure that they're making their prenatal appointments, checking on them to ensure that their pregnancy is going well and any needs that they might have. And we also follow them until after postpartum. Again, we make sure that they go to those postpartum visits And if they're having any signs of postpartum depression, or after we've done our screenings, we connect them with postpartum services. Early childhood, we do that through our education and developmental milestone for our moms. And we educate our moms in regards to what to look for at certain stages within growth of their child. Next, please, Keila. So as I mentioned, we focus on these specific zip codes, and reason for that being that the US Census found that people with less education or income tend to live in neighborhoods that lack access to food and safe place to exercise. And so in addition to that, they face increased advertisements of tobacco, alcohol, high calories food. Residents of low-income neighborhood may also be exposed to risk factors, and these factors can increase their chances in developing chronic diseases later on. And so we focus here to make sure that we, for our mothers, we are addressing these, and we are making sure that they are connected to healthcare services early. Next, please. So as I mentioned, we do complement our sister program, which is Nurse Family Partnership, which is also at Caring, and that's one of our services at Caring as well. And Nurse Family Partnership, they serves low-income pregnant individuals and individuals who've had previous births, and those individuals who are at risk for poor birth or health outcomes. And so for Nurse Family Partnership, they do utilize nurses. So they have nurses who would work with their participants up until the child turns 2 years old. And a Nurse Family Partnership, because of the nurses they use, they work more on a clinical approach within their program in addressing maternal-child disparities. And for Nurse Family Partnership as well, their curriculum is much more structured, much more rigid, and they have to follow certain guidelines within their curriculums, which is a bit different from a guided journey. Next, please. So to share with you about a guided journey, so we are a maternal child health program, and we are supported by Mecklenburg County Community Health Worker Initiative. And our aim is really to support pregnant women and women who are at least 3 months postpartum. And we link them to community resources, ensure that they have a primary care, a OBGYN provider that they can go to before and even after delivery. And also to ensure that we provide an education. With most of our participants, most of them are first-time mom or young moms. And so that educational piece, our CW works with them to kind of lead them through that journey. So our CHW in a guided journey, we work with families once they're enrolled in our program. We work with them up until the child turns 3 years old. And what our main focus is while we're working with them is to ensure economic stability. We want to make sure that once our participants exit our program, they are able to navigate the community, or they would have already been established with community resource there that they can be self-sufficient. So that's something that we work with, and we're proud to work with our participants on that to make sure that once they exit our program within that 3 years, that they are able to effectively navigate the community and get linkage to service. our neighborhood and physical environment. So some of them might be looking for housing to make sure that they have a safe place for their newborn or their children that they might have before. As I mentioned, education, we do a lot of perinatal education. And one thing I must say that our community health workers are certified perinatal community health educators. And we have completed that educational part through Center for Community Alignment at South Carolina. So we are proud of our CHWs of having that extra training to work with our maternal child health population. Food, we know that's a big insecurity within our communities. And so our community health workers work very closely to ensure our families have food to provide for their families. And as I said, linkage to healthcare system, we try to link them to, especially our uninsured, we try to link them, our participants, to healthcare, like OBGYN clinics that can do sliding scale for them so that they can get care. Our CHW also live and work within the community. So that's one feather in the cap for them, because they definitely know the community they're serving. They know what resources are out there, what are some of those community needs that they might have. And so they're better able to help those participants within those communities. Within our program, we do home visits. So we are also a home visiting program. And we would visit, when I say visit, visits can be a monthly call to our participants to see how they're doing, just to check in. Or also it can be a home visit. And home visit can be meeting our participants where they're at. It can be out in the community. It doesn't have to be necessarily in their homes. And we are able to meet them. Some of our participants meet us during their lunch breaks, so we have that to meet them where they at, to have that engagement with them. Next, Keila. So here, it's just a little outline as to the difference between nurse-family partnership and a guided journey. And I wouldn't go over everything here because we mentioned it before, but I just wanted to also just highlight focuses on clinical approach. And with nurse-family partnership, they're focusing more clinical approach within their program. And a guided journey focuses on a community approach. And for a guided journey, with regards to our community approach, we listen to our community. We listen to the needs that's within our community, and that's how we work around our participants to address those needs. So for our program eligibility, participants are eligible for our program if they are pregnant or they are at least 3 months postpartum. So they have to enroll in our program within this time period. We also look at income level. And so our participants must be at least 200% below federal poverty lines. And they must be a resident of Mecklenburg County or live within our priority zip codes. So I'm always excited to share what our CHWs do, because they are out there working very hard to ensure that our community are connected to services and resources, and so as to meet those needs. And so our community health worker, we do referrals for our participants. So for example, one of our participants might come into our program and they have given birth. A lot of them might not know how to navigate the social service system. And so we guide them as to what social services they're eligible for. We help them with those referrals. We help them with filling out those paperworks, and we follow up to make sure that they receive those services. In regards to linkage to medical home, so as I mentioned before, a lot of our participants are uninsured, and so we link them to low-cost clinic after they've given birth so that they can continue to have that medical care. And also our community health workers are very engaged within our community. So if you're in Mecklenburg County, you might see us a lot of events. We are very active out there. And organizations love to invite us to come to their events, and we're glad to be there. And most of our community events and outreach, our community health workers would go there, kind of share our program with our community and just have that whole engagement out in the community. Next, please, Keila. So
next week.
I talked to Demita's.
I'm sorry. Okay. So I'm just going to speak a little bit about our program outcomes. And so these are some of the outcomes of our program and the work that we are doing. So within our program, we have our participants. So these goals are mainly set by our participants and what they want to work on what we can help them with. And so we've had about 80% of our participants who've completed those goals that they wanted to work on. Medical home, we've had 83% of our participants connected to medical homes. Postpartum care within 6 weeks of delivery. So our community health worker would do one visit with our participants at least 6 weeks after they're delivered. And that percentage you can see there has been about 86%. Report and ever breastfeeding. So we are big on breastfeeding. So we do provide breastfeeding education to our participants and ensuring that they are, breastfeeding their newborn. And so that's about 85% who reported that they've breastfed their newborn. So screening for depression, we know this is also a big one within our maternal population. And so this is something we focus deeply on as well. And we've had a 96% of our participants screened for postpartum depression. With healthy birth weights, we've had 93% of our participants who have had a healthy baby. And with healthy birth weights after upon delivery. Next, please. So for our referral process, we try to make our referral process as simple as possible for our participants. And so if someone is meet our eligibility, they do not have to wait on our social worker or any worker that they're connected with to refer them to our program. So we, on our flyer we give out within our community, we do have our QR code. And so those moms can self-refer. Some of them we might reach, they might not, really want to be in the program right away. They might need some time to think. And so they can have at their convenience, refer themselves to us. Also, agencies also can refer clients. We have partnerships with a few agencies that we get referrals from. And we also have partnered with Novant Health, which we go over there as well to meet with these new moms and also enroll them in our program. Next, please. And here is just a few images of the work that our CHWs are doing out in the community. And so, as I mentioned, we're very engaged. We're always out there. You might see us around a lot. And so we are glad, and our CHWs are very excited about their work they're doing with our maternal child health population and also being out in our community. Next, please. So now we're going to be open for questions. Any questions you might ask, you might have for myself or Keila.
Thank you both. That was great. It looks like there is a question in the chat. I'm not sure what windows you have open, knowing that you're in presentation mode, so I'll go ahead and read it for you. It's a question about the certifications and trainings of the community health workers and asking what are the most common professional pathways or backgrounds for community health workers in a guided journey, or community health workers more broadly who are working in our county.
Yeah, so I'll speak to pathways more broadly for community health workers. I know right now the state is actively working on those pathways. So they are thinking about making community health workers a tiered approach. So community health worker 1, 2, 3, and within those tiered approach will be different responsibilities that a community health worker can conduct, but that is still ongoing. North Carolina, we are still developing and building what this workforce will look like in the future, so more to come. But to give you a heads up, there is some pathways being developed, and that will be pushed out from the North Carolina Community Health Workers Association.
Great, thank you. There's a question asking if we can talk a little bit more about NC Care 360 and how it's used to connect community members to local social determinants of health resources.
Yes, so NC Care 360 is a statewide platform that has healthcare and social care service organizations on the platform, and you can send referrals within these organizations. And so it is meant to be utilized where you can refer a participant or a client to a particular service, and the other organization receives that referral and then be able to enroll the client thereafter into whatever particular program that client was interested in. It is a fairly new platform within our state, and so that is something that they are actively building and trying to get more organizations to be a part of it, because like any interface or any platform, it is only as good as the organizations and people that use it. So the more people that are on there, the more robust the platform itself will be. But right now, that is something that A Guided Journey is using, and then other community health partners are using as well to send referrals in the Charlotte community and beyond. So.
And there are a couple more questions in the chat, but I just want to make a quick announcement that as we're going through the questions, keep an eye on your chat box. Michael is going to drop in the link to our Qualtrics survey. So as you're sort of thinking about what questions or listening to the speakers continue, take about 2 minutes or so to complete this anonymous survey. Of course, it's going to help us guide what is meaningful and informative for these sessions. Again, as Michael alluded to with the CHES credits or social work credits, when you answer those questions, you'll have some additional questions that will help us process those requests for credits. Okay, back to the chat. It looks like there is a great question about, is there any way to volunteer with the program? And I'm guessing, I don't know if that's specifically community health workers or A Guided Journey.
Well, I can't speak on behalf of A Guided Journey, but I am always willing to take some help for the Community Health Worker Initiative. So if you would email me, or I know on the web, the health department's website, the Community Health Worker Initiative's email address is chwi@mecnc.gov. I can also be contacted that way. Omeika, did you have anything to?
So for a guided journey, because we are also a service within Caring do have volunteers. And so if you go through our general volunteer system, you can say that you're interested specifically for a guided journey, and you can definitely volunteer within our program. So if you go on the Caring's website, you will see the volunteer site, and you just click the volunteer. The request will come into our development team, and then they would distribute it to the departments.
Great, thank you. There's a question about, do you help with housing needs? And I'm actually going to expand on that a little bit more and ask sort of the clients that you're serving, what are some of the more common challenges that you're helping folks with? I'm assuming housing is one of them, but if there's others, I'd like to hear that too.
For us, for housing, we know housing is difficult in Charlotte. And so it has been a challenge for us in getting our participants connected to housing. And for that, we just advise them to, apply, make sure they're monitoring that housing wait list. And in the meanwhile, they are working on housing. We work around them in kind of probably their needs. So they're looking for a job. Probably if they have a job, they'll be able to find an apartment or, somewhere that they'll be able to pay in order to get those to somewhere to live. But it is still been a challenge for us in regards to housing. And the second part of your question was, I'm sorry.
Just other common challenges that you see among the folks that you serve.
So another challenge we see a lot, and this is mostly within our Latinx population, we do have our participants who might be undocumented. And so it has been a challenge for us in finding resources that they might be eligible for. And so our community health workers, they go on the internet and they look for all resources possible that they can find. We know the resources are limited out there, but our participants are very happy and appreciative of whatever resources our community health worker can help them with. But that's really mostly our big challenge, and also uninsured. A lot of our participants are underinsured or uninsured. And so that has also been something that, we work with them on in regards to get having that bridge to healthcare, ensuring that they have that regular checkup with their provider.
Thank you.
Mm-hmm.
I think probably even for undocumented folks who may be eligible for certain programs or services, there's also a trust barrier, I would guess, which I think is another sort of soft skill that I'm sure your folks are great at brokering those relationships. There's, back to the chat, there's a question here about clients, if they can receive services from both nurse family partnerships and your community health workers simultaneously. And similarly, if there is a client during your 3-year service period that you're with a client, if they become pregnant again during that 3-year window, can they start over with a new service for that second pregnancy and extend their care or their relationship or membership in the program?
So that one is actually an interesting question about extending care. If they do become pregnant within that 3-year though, they can enroll that new child that they've given birth to within our program, because we enroll each child, mom and child, within our program. So if the mom she gives birth again within those 3 years, then we can definitely enroll that child. In regards to extension of the time, that one I would have to verify in regards to that. But I'm thinking if we're working with each child and that child is enrolled, say a year into mom or 2 years into mom being initially enrolled, then we will continue still working with her and that child until, so one child would exit out our program at 3, but she would still remain in our program because we're going to be working with that second child until the child turns 3 years old.
And are clients eligible to receive services simultaneously from a guided journey and nurse family partnership, or is it sort of one or the other?
So they can be duly enrolled in our programs. And it all depends on nurse family partnership assessment and what they're working with nurse family partnership with. So because nurse family partnership is more clinical, they would say, reach out to us and be, this mom, she's enrolled in our program, but however, she really has needs in regards to community resources. And can you guys help her? So we can do that. Currently, we do not have dual enrollment, but that's something we're looking into if someone needs both programs.
And the next question coming from the chat, I apologize, I might have to call this person out. Unique has a question in here about HIV screening, and there is an acronym in the question that I'm not familiar with, PMTCT. So if y'all are familiar with, if you could talk about the if there are HIV screening services that are offered through your work, either a guided journey or more generally with the Community Health Worker Initiative, if you could speak to that. And then Unique, if based on their responses, if we're not hitting the core of your question, feel free to chime in and clarify for me.
Yeah, so I'll take a stab at this question. I think HIV screening, it is very important, and it can also be specific to the population. So I think that would depend on if that is part of Caring's normal screening processes. As far as the Community Health Worker Initiative goes, the answer is no, just because we are still building out the foundation of what this work will look like at the health department. But we do offer HIV screening through our more HIV specific programs that are held at another, within another division. So.
And thank you, Unique. It looked like you spelled out that acronym for me. I appreciate that. There are a lot of great questions in the chat, so I will just keep on going if you guys if you guys are ready to keep going as well. There is a question in there about NC Care 360 as a referral platform, and can we track the response time between when a referral is made and when that connection to the client is made?
I do know you can track the client. As far as the response time, that I am unsure of. I feel like that is more of an NC Care 360 question, something that they are better equipped to respond to.
And just in the spirit of making this kind of a community dialogue, if there are any pieces that if somebody has particular experience with NC Care 360 and can respond to that part of the question, feel free to drop that in the chat for everyone's benefit. A question about customers that are connected to SNAP or Medicaid. Have you conferred with DSS as a referral source to the program, particularly as economic benefits have been expanded for postpartum customers? So are you working, is there partnerships or relationships with DSS for the purposes of getting referrals into the program?
Omeika.
So yes, so I have personally attended DSS meetings, their general staff meeting, and so I spoke with within that meeting about our program as well. And I can't remember his name, but I did send over our referral form information on our program as well there. So we are in connection with DSS as well for referrals to our program. Yeah.
For women that you may be working with who are, and I guess this could be for a guided journey or again, generally for community health worker, if there are folks that you're working with who express a desire to stop tobacco use, are you aware or using the Quit line NC and the services and resources that are available there?
Yeah, so our participants who say that they're interested in quitting, we do provide them the quitting, the hotline, and also we provide them information on, you know, ways to quit, and so that they can also make that decision or even speak with their healthcare provider and on what are some options or alternatives they have in regards to quitting.
And it looks like there, with that question, an email address dropped in there if you want to make a direct link to somebody on the public health side that might be able to connect you with any more resources or answer any questions you may have. What resources are offered to program participants dealing with postpartum depression? So when you showed that table, we noticed that was a pretty high percentage of your folks that are being screened, but depending on the results of the screening, what are the resources that you're able to offer or connect them to?
So for our participants, we do have most of our participants who do not fall within that line of having postpartum depression. However, the few that we do have, we do refer them to mental health services in regards to therapy, depression. So we use a lot of, we usually send like to Monarch. We do referral there so they can have those mental health evaluation within our program. And we also do follow up closely with them. So instead of us probably reaching out to them once a month, we might reach out to them once a week, just to have that close eye on them during that time and ensure especially that they do go to their appointments.
All right, the next question, and now I'm going to start asking Michael to keep me honest on time and make sure we're doing okay there. There's a question about SIDS training or safe sleep training for mothers or families that you're working with. Is that part of sort of the suite of information that you talk about with your health educators?
So yes, so within our perinatal training, we did have someone come in and talk to our CAWs on safe sleep and also car seats, which is also a big one. So that is a part of our perinatal training for our CAW. So they do also provide that education to our moms. And that education is also actually conducted during that first visit once they're meeting them within that 6 weeks of the newborn visit. They will provide that education to mom, ensuring. So we do breastfeeding, safe sleep, car seat, and we do car seat training, our education even before delivery, because once that baby comes out of the hospital, they're going into a car to go home. So we do that, definitely do that education before. Yes.
So I think the short answer to most of these questions is yes, we do that. we have yet to stumble into an area where you haven't already thought about it or created a plan for it. I think that certainly speaks to the great work and the thought that has gone into this program. I know we had talked about how, oh, go ahead.
No. I just wanted to say that Keila does a great job in keeping us updated with training. So she thinks everything she needs to do. Yes.
Thanks, Omeika.
There is, we had talked about housing before. and there's kind of a more specific question about support for either folks experiencing homelessness or folks who report drug use. Is there anything with either of those that you can speak to, and how you approach that as a program?
That's actually a difficult one to answer too.
Sure.
And in regards to, drug use, and that's usually a part of our screening question once we do our postpartum screening. And if there's, of course, it has to be where the participants want to actually reduce those use, but we also do encourage them to seek help, and community help. But we really haven't had much of our participants who we had to refer out for drug use. Most of them know, are aware that even during pregnancy or breastfeeding, even if they were using heavily before, they would stop during that time.
Looks like maybe the last question in the chat, and maybe the last one that we have time for, is about processes for referrals for family planning services or other contraceptive services during the program time. What does that look like?
So for contraceptive services, we also do family planning with our mothers. And so if we kind of go through that education in regards to what contraceptives are out there and which ones they are, they want to use in order to prevent any birth or any of that. So in regards to Planned Parenthood or community resources, a lot of our participants who would have entered our program would have known about contraceptive. They actually tell us what worked for them, what didn't work for them. And so they are much aware of what is out there for them to use and where they can get it to purchase. So, but we do definitely go over our family planning area with them.
And James, thank you for keeping me honest. I did skip your question by accident, and it's a good one, so we'll go back to it, about community health workers receiving training to address parenting supports or concerns for mothers. So, right, parenting a newborn, women are in your program for 3 years, if you've been around a 2-year-old or a 3-year-old, you know that parenting them is very different than parenting a newborn. What kind of supports or trainings are you able to offer, either your community health workers or the mothers themselves, or mothers and families?
So I responded in the chat that they initially receive a overarching perinatal training that covers all these many things that were kind of elevated in the chat. Any in-depth trainings are done kind of ad hoc. So in regards to, I guess, the additional supports, that is something that is ongoing and something that we are more than welcome to accommodate into the program as time progresses. But Omeika, do you want to add anything?
No, our perinatal training, as I mentioned, it's not only about pregnancy or phases in pregnancy or delivery. It's everything that surrounds a newborn. It's everything that surrounds mom. It's a more holistic approach to perinatal care in regards to that. So there's a large area, I can't say it out as all the topics that's covered within that training. And it's a very, it's not a one-day training, it's right. About 6 days of training. So,
full days.
Yes, full days. So it's very, very intensive. All the areas that we need to cover in regards to mom and baby.
Oh, there's a great comment in the chat about our ICO for MCH program offering training as well. And I hate to be the one to do this, but this is about all the time we have for questions. I think we can give Keila and Omeika at least a minute to catch their breath. We've thrown a lot at you, and you've handled it well. Thank you both very much for fielding all of those questions. If you do have anything that you'd like to make sure is covered, our panelists might have a moment to stay on after we formally close the program to address any lingering questions. But I will turn it back over to Michael for a moment.
Great, thank you, Carrie. And wow, that was an awesome presentation. As a reminder, I've dropped the Qualtrics survey link into the chat. We'd like everyone to give us our quick responses to the satisfaction with today's session, especially if you're asking for continuing education credit, CHES, and social work in particular. There's some additional questions that you need to answer through that form. And we'll also post this link, as well as eventually the recording and information from today's session on the APHI Innovation website. So we'll leave that survey open for a week or so to give people a chance to catch up on that. You will be getting some contact information emails afterwards as well.
And Michael, I see that you've posted it in there a few times to keep it fresh, and our presenters understandably have gotten some great accolades in the chat. Might be worth dropping it in there again so folks don't have to keep scrolling back. So I'd like to thank our panelists for sharing their time and talents with us today and helping us to understand the great work being done to improve maternal and child health outcomes. I hope we've provided some insights into how community engaged practice can bring about real and lasting changes in health disparities, and how there is just a web of resources that are out there that can meet lots of the needs, but certainly not if we don't take advantage of them, and opportunities to expand the resources that we do have.
Great. And I wanted to thank you all for joining us today and making this event a wonderful success. I want to thank you again also for what you do each and every day to help make us a healthier and happier community. I hope you've enjoyed this brief respite with us today.
And this concludes today's APHI Innovations in Public Health series. Please join us for our next session coming up in December. This session will feature a presentation from our award-winning Child Development Community Policing Program. So thank you all for your time and your engagement today.
Thank you. And my final thought for the day builds on this notion of journeying that we raised today, and it comes from Oliver Wendell Holmes, who reminded us that a mind that is stretched by new experience can never go back to its old dimensions. This insight reminds us that each interaction, each new experience permanently changes in some way. And I hope that our time together today has stretched your mind a bit and you're thankful for having journeyed with us for a while. So we're going to stop the recording, but as Carrie noted, we're going to hang on for a few minutes if you have any last minute questions or comments. Otherwise, we look forward to seeing you in December. Thank you.